Welcome, everyone. My name is Noah Ha, and today my teammates Riley, Jasmine, Amber, and Kayleen will be discussing mental health care for teens after the California wildfire. The table of contents are 1. Introduction to California wildfires, 2. The psychological impact, 3. Support strategies, 4. The barriers to mental health care, and 5. Government and nonprofit interventions. 1. Introduction. Wildfires have been a recurring issue in California, as you can see with the recent LA fires in the Palisades area. The fires are becoming more frequent and severe over time, and rising temperatures and dry conditions have led to huge wildfires. As strong winds spread fires faster, it leads to a more disastrous situation, impacting an estimated 12,000 acres of structure. Not only did a big amount of homes and neighborhoods face the consequences, but schools have as well. Schools have closed due to poor air quality and safety concerns, and due to this, teenagers have been experiencing stress, anxiety, and disruptions to daily life. Why teens are vulnerable? Teens are vulnerable because of loss of friendships, disruptions in homes, high risk of PTSD, emotional and psychological stress that makes teens vulnerable. Teens experienced during natural disaster report to higher distress and suicidal ideation. Missing school after disasters leads to lower grades or even dropping out. Spreading awareness. The purpose of this whole presentation is to understand the effects the California wildfire had on teens and to discover solutions to many face barriers like economic instability and limited mental health resources. Understanding these help us identify solutions, including better access to counseling, stronger community support, and improved disaster response.
My name is Riley, and I will be going over the psychological impact. Wildfires leave lasting emotional and psychological scars, affecting both those who lose their homes and those who don't. Iris Kameni was 92 years old when she lost her home in Chino, California due to the devastating Palisades and Eaton fires, along with irreplaceable family photos and furniture from her early marriage. Police Chief Eric Reinbold of Paradise, California, avoided wildfire news to limit his grief over the destruction in his community. Studies show a rise in ER visits for anxiety disorders after wildfires, and in Alberta, Canada, a third of survivors of the 2016 wildfire experienced depression, anxiety, PTSD, or substance use disorders. Beyond personal loss, the destruction of natural spaces like parks and hiking trails deepens the psychological distress. Wildfires can have profound psychological and physical effects on individuals, particularly children and family, who lose their support system due to the destruction of schools and community spaces. The physical health of children is a concern due to exposure to smoke and ash, while the emotional impact of traumatic events can lead to amplified sensitivity to danger cues, flashbacks, and nightmares and avoidance behaviors. Trauma survivors may experience persistent irritability, sadness, and burnout, with children displaying distress such as depressive behaviors or reenacting fire-related scenarios through play. Providing children with time, space, and reassurance to process their emotions is essential, especially for school-age children who benefit from open discussions about their experiences. The Substance Abuse and Mental Health Services Administration writes that anxiety, depression-like symptoms, and sleep disturbances are common before, during, and after fire exposure. Studies show increased emergency department visits for anxiety and greater use of mental health medications, particularly among women, girls, and elderly individuals. In wildfire-affected areas from 2011 to 2018, prescriptions for antidepressants and mood stabilizers significantly rose. Additionally, cognitive difficulties such as diminished concentration can persist for up to a year following exposure, highlighting the long-term mental health challenges faced by survivors.
Now we'll move on to discussing support strategies that schools, peers, and families can implement. So first, I'll talk about school-based mental health programs. Schools are one of the places where students can get mental health support they need, and there are many ways school can aid students struggling with mental crisis. First, what schools can do is that the school counselors and therapists can guide students through their emotions and help them process trauma. That's why many schools also offer wellness programs that can help students reduce anxiety and create a more supportive environment for the students. For example, in Los Angeles, the Los Angeles Unified School District provides mental health services specifically designed to support students struggling with emotional challenges. And for students struggling with high-risk mental issues, there are also crisis response teams that can step up and help those detrimental cases, and it can help them get immediate help. And finally, it's essential for schools to regularly check in and see how students are faring mentally and emotionally, and spread awareness programs to help normalize the conversation about mental health while also teaching students important coping skills. Beyond school programs, peer support is also a really incredibly powerful tool. So, having a strong social network can help students feel less alone and more understood. One of the best things students can do is talk to trusted individuals. This can be your friend, mentor, or family member, or really just anyone you can rely on. Just having a safe space to express emotions can make a big difference for many students. So, in while talking to trusted individuals, supportive conversations can help validate emotions. And sometimes just knowing that someone understands what you're going through is enough to ease the stress for many students who are going through mental crisis. And feeling isolated can make everything seem worse, so having people to rely on can reduce that sense of loneliness. And another great option is group therapy, which is one of the form of peer support. Group therapy is a safe space where students can open up about their experience without judgment. And this can actually contribute to a sense of community because you're not alone, you're talking to people, and it can help reduce symptoms of stress, anxiety, and depression. And an important factor of group therapy is that many people that are going through the same struggles and mental health crisis are talking together. So, this can contribute to emotional validation from others who are going through similar challenges. Lastly, I'll talk about role of parents and educators. Parents and educators also play a huge role in helping students recover from trauma. One of the things they can do is step up and create a safe space for students. This applies to both parents and educators. And what this means that is encouraging open conversations about emotions without judgment. When kids feel comfortable talking about their feelings, especially to their trusted individuals, they're more likely to process their experiences in a healthy way because many teenagers tend to repress their emotions and depressions and keep them to themselves and feel isolated, which can be really unhealthy. And it's also really critical for parents and educators to recognize warning signs of distress. And some of the common signs include withdrawal, extreme fatigue, or even aggressive outburst. If a student has a history of emotional struggles or trauma, it is important for parents and educators to recognize that those students might be at a higher risk of mental health challenges. Finally, trauma-informed training for educators can be really valuable. This type of training helps teachers and school staff learn how to identify signs of trauma, provide appropriate support, and create a more understanding learning environment. Programs like Foundations of Trauma Informed Practice offer free self-paced training that can help educators better support their students.
Next, my name is Jasmine Lee, and I will be discussing the barriers to mental health care. First, First is the limited access to therapy and counseling. Charles Figley, Charles Figley, a psychology professor at Tulane University, says, the need for help is going to be immense, and it could apply to anybody. It's not about strength or intelligence or anything like that. The demand for therapy and counseling remain high due to the widespread effect from the fire. This life-altering disaster caused a lot of emotional toll on individuals, such as kids and adults who have lost their homes, or second-level victims who may suffer from survivor's guilt. The severity of this impact may cause a lasting trauma, or similarly, PTSD, post-traumatic stress disorder. Though there may be many mental health resources to call during this stressful time, the ratio of the impacted community and the responders is too big to meet everyone's needs. Next is the stigma around seeking help. First, individuals could feel embarrassment or fear of judgment in reaching out for help. It depends on a family's attitude towards mental health, which could impact how adults and teenagers feel to seek support for their feelings. For example, comparing the LA fire disaster to previous incidents, a 2023 survey states that majority of responders, almost 61%, believe that others expected them to just get over it. Moreover, existing mental health problems such as anxiety or depression could worsen an individual's reaction to the impact that the fire has caused. Coping with a long-term stress could take an extended amount of time, and teenagers could feel burdened in reaching out for needed support due to this. Finally, a big factor is economic challenges. Despite a family's economic status, losing a home is never easy, and families may struggle financially. The area that was most impacted was a fairly wealthy one, with home prices stretching from $1 million to $2 million. But these economic challenges could override the need for mental health support. The money needed for therapy and counseling contributes to the financial struggles that these families face currently already, leading to the ultimate barrier of mental health care.
I'm Amber, and lastly, we will be going over government and nonprofit interventions. Government organizations like FEMA have a helpful role in providing financial support to those in need, ensuring access to mental health support programs for those who have endured traumatic events. Their funding helps people recover from these events, addressing immediate needs while setting the foundation for long-term resilience. Meanwhile, nonprofits such as the American Red Cross and CalHope focus on specialized care, particularly for youth, providing services such as counseling, peer support, and other targeted mental health programs. Together, these organizations work to address the complex challenges faced by individuals themselves and their families, offering both immediate relief and ongoing support. For those seeking additional resources, there are specific hotlines that are available that offer immediate assistance. The Disaster Distress Helpline, for instance, can be reached at 1-800-985-5990, and the Crisis Text Line can be reached by texting HOME to 741-741. These services are designed to ease the recent emotional stress caused by disasters, giving people someone to turn to during difficult times. However, short-term aid alone is not enough. The impact of trauma often lingers long after a disaster has passed. Conditions like PTSD can manifest weeks or months later, which emphasizes the importance of consistent and long-term mental health care. Without proper support, untreated trauma can lead to hurtful consequences, making recovery much harder. Prioritizing care and awareness helps ensure that emotional well-being is given the attention it needs, which contributes to a healthier and more supportive environment for all. Teen mental health is often overlooked following disasters, but it remains one of the most critical components of recovery. Addressing the emotional and psychological well-being of teens who experience these tragic events is not just an option, but a necessity. Providing care of the unique challenges teens face can make a significant difference in their ability to heal and move forward in times of crisis. By normalizing the conversation around mental health and offering supportive resources, we can encourage teens to seek the help they need without hesitation. This proactive approach can also empower them to process their experiences, build resilience, and access the tools needed for recovery. These are the resources that we used. And thank you so much for listening. If you want more information, you can contact the S.O.S Teen Hotline or visit the website. Thank you.